Thanks for having me, Ben and everyone. And apologies, my screen's a little bit funny arranged. If I don't look straight into the camera, that's the reason. I don't want to waste much time, so I'll just start sharing my slides and sharing my screen. Hold on. So I thought I'm gonna talk very briefly about a creative health focus in relation to the 15-minute neighborhoods, because I think there is a very clear and obvious link. Although there's healthcare as an element there in the nice diagram that we've already seen of the 15-minute neighborhoods. I just want to briefly focus on what we mean by creative health, and this comes in the context of, as you can see on the screen, we have just launched this autumn gone a master's in creative health here at the Bloomsbury campus, but this master's is an early adopter for the UCL East campus. So all things going well, in the autumn we'll be starting our second year of the master's creative health from the UCL East campus. And hopefully there will be lots of opportunities then for people to come in and work with us, because it's a community-based master's program, in particular the dissertation element, but also other elements involve quite a lot of working with community partners. And we're very keen of working with community partners in Newham and the Olympic boroughs in particular. Also, just to add that I'm a former Newham resident. I've just during the lockdown, I had to relocate because of my wife's working commitments elsewhere. But before that, I was in North Woolwich, Silvertown, for a good few years, 6-7 years, and really liked living right by the river. So I have an inside knowledge of Newham as well, of the geography of Newham. So I just thought I'd start very briefly with something like the definition of what we mean, or what creative health is, which might hopefully be useful to think about. And it comes from this report, the All-Party Parliamentary Group on Health, Arts, Health and Wellbeing, that was published in 2017. And in that, the definition that we came up with is creative health is about creating the conditions and opportunities for arts, creativity and culture to be embedded in the health of the public. So it's about thinking about culture and nature in the broadest term, and creativity, and how this can support public health. And the report is downloadable from the Parliament website, but also from the Culture and Health and Wellbeing Alliance website. And the link is here on the slides, which I'm happy to make available. So the key criteria, the key points about creative health are, we're talking about interventions that are non-clinical, that are asset-based, if that means something to some of you. In a sense, they're culture, nature, arts based in a very broadest sense, interventions that focus on health and potentially therapeutic outcome. The key focus is on community assets and health equity or health inequity, pretty much as this defined, and a lot of inspiration has been taken from the work of Michael Marmot, who many of you might be familiar with. And his work on health equity and the Institute of Health Equity more generally. So these are the definitions. If I then move on and just highlight two areas of creative health, I think that are going to be particularly useful. Okay, so very briefly, so one of those areas I wanted to focus on is the impact of nature, and which is clearly important, and green spaces are mentioned in the 15-minute neighborhoods. But so what this diagram from Michael Marmot's work highlights is the relationship between cardiovascular health, in particular cardiovascular death, and living close to green spaces. And if you can see on the far right, in the dark green is the most deprived income group, the light green is the least deprived income group. But even the most deprived income group has better cardiovascular health if they're living close to nature, which is the group 5 on the far right, than the group 1 and 2 on the left, which are living further away from green spaces. So there's a direct relationship between health and outdoor spaces and access to these spaces. So this is something to think about in relation to Newham and the strategy. And similarly, if you look at the breakdown in terms of access to having own green spaces, having back gardens, that how this is unequally broken down, that if you look at the white population of England, it's essentially over 80%, nearly 90% of people have access to their own green space, a private green space like a garden. Whereas if you look at the Afro-Caribbean community, for example, it's about 50%. So it's about half of the access. So there's a clear difference. And if you then think of the implications of that for cardiovascular and other health issues, it's striking and something to think about in terms of making plans of what people have access to within 15 minutes. And the other area I wanted to highlight is the impact of culture, which Daisy Fancourt from UCL Epidemiology and Saoirse Finn have highlighted in the WHO report that came out a couple of years ago, is the impact of the arts and culture more generally. And this is some of our own work on the left here from museums and collections, where we worked with older adults who are socially isolated. And what the slide shows, what the diagram shows is an improvement in their personal well-being using the museum well-being measure that you can also see that we developed for that purpose at the beginning and the end of a 10-week session. And the key is these are statistically significant changes in people's well-being. So access to culture in the broadest sense is an important element. And Newham is one of the few boroughs in London, sadly, which doesn't have a museum. Just to highlight that. There's plenty of heritage and there's the Heritage Week, but there's no museum. And I'm conscious of time, and I wasted a bit of time with my slides, so sorry about this, but just to summarize this and finish up. So I think if you think about the 15-minute neighborhoods, there's a real need to think about the natural and cultural assets that are rich, and in particularly the equal access to green spaces, and also how we can distribute the access to cultural heritage more generally. And especially access to culture is, I think, really important. And I think that's all I have to say about Ben. Thanks so much.